I'm going to give you 5 ways that sugar can seriously be damaging your kidneys. My goal is to give you the knowledge you need to protect yourself. Number 4, the clogged pipes, blood vessel damage. So when you have high blood sugar or hyperglycemia, that blood sugar is actually toxic or poisonous to your blood vessels. And inside of your kidneys, those kidney filters, there are many, many little tiny blood vessels, okay? Like little tiny pipes. If you have excessively high blood sugar, then it damages the lining on the inside of those blood vessels, causing the blood flow to not be what it should be. And it can also cause you to have a high blood pressure. Not only a high blood pressure inside of the kidney filters, but it can lead to you having high blood pressure systemically, high blood pressure throughout your body. Think of the blood vessels in your kidney filters like the pipes that run in your home. If your pipes have a lot of rust, that rust can clog them and cause them to be narrow as far as the water flow through pipes. And if you have narrowed pipes, that causes a backup, right? And you can get a high pressure in the pipes, but then still not be getting the water flow that you need. Same thing in your body. When those kidney vessels are clogged due to the damage from high blood sugar, you can get a backup causing a high pressure, not only in the kidneys, but a high pressure in your body, and the kidneys just won't function as well as they should as far as filtering your body. Here's one step that can help you to kind of monitor what's going on as far as the pressure. In your home, check your own blood pressure. Yes, monitor your blood pressure at home. Make sure that your body is in the right position, that you have the proper size blood pressure cuff. Be sure you click the link in my bio or visit drfrida.com, and I share some of my favorite home blood pressure cuffs. Remember, the lower your blood pressure in your body, the lower the pressure in those kidney filters, and that's going to be helpful for your overall kidney health. As far as the labs to ask your doctor for, hemoglobin A1C is an excellent one. The hemoglobin A1C is a measure of what your blood sugar is. And the good thing about the hemoglobin A1C is that it's not just a snapshot of how your blood glucose or blood sugar is at one particular time. The hemoglobin A1C actually gives us an average of what your blood sugar has been over the past 3 months. It really lets us know how well your blood sugar is being controlled. Remember that if you have a hemoglobin A1C of 6.5 or higher, that is consistent with the diagnosis of diabetes. And so you want to consult with your doctor to make sure you keep this hemoglobin A1C at a lower level. A smart food choice to help with these clogged pipes or this blood vessel damage: foods high in omega-3 fatty acids like fish and walnuts. When you eat these foods, then it helps to improve the flexibility of your blood vessels and your overall kidney health. Number 5, the communication breakdown. Nerve damage. Now here's one that people often forget. Diabetes and high blood sugar actually damage the nerves, okay? They cause neuropathy. You might recall that people will get diabetic neuropathy. They might have tingling or numbness of their toes or tingling and numbness of the fingers. But guess what? You can also get nerve damage to your bladder. And this can be a big issue in your kidney health. If you develop nerve damage to your bladder due to the diabetes or high blood sugar, this can cause an issue, and it can keep you from knowing when your bladder is full and when you need to empty it. And it can also cause you to lose control of your bladder and have urinary incontinence. Now, if you are unable to fully empty your bladder and you get a backup of urine, well, that urine can continue to back up through your ureters. Okay, those are the tubes that connect your bladder to the kidneys, and you can get something called hydronephrosis, which is a backup of urine in your actual kidneys, and it causes a pressure and an enlargement in the kidneys, and it can lead to kidney damage. So yes, all of this can happen due to a breakdown in communication from nerve damage and diabetes. The other thing that can happen is that if you have a backup of urine, you're not completely emptying your bladder, then that increases your risk for a UTI or urinary tract infection. If you have a urinary tract infection in the bladder and you also get it in your kidneys, so a kidney urinary infection, a kidney infection is called pyelonephritis. If you get this backup of urine in your bladder and it causes you to have infected urine in your kidneys, then that can lead to recurrent pyelonephritis, which can also lead to kidney damage. So yes, having high blood sugar is a sneaky way to damage your kidneys just from having a breakdown in communication or diabetic neuropathy that affects the bladder. If you think of your bladder like a sink, that might make sense. So if you have a sink and you put water in it, as long as you empty that water, okay, if you let the water go down the drain regularly, then the water will be relatively clean. But if you allow the water to just sit there over time, it will collect dust, dirt, and it will become unclean, right? Same thing with urine that just sits in the bladder. It's more likely to become infected if you have a backup of urine in your bladder. One thing you can do to prevent this backup of urine is have timed voiding or a set time to empty your bladder. So I recommend going to the restroom every 2 to 3 hours, even if you don't feel like your bladder is full. That is one good way to prevent having this backup of urine, which can lead to complications. As far as labs to ask your doctor for, there's no one particular lab. You can certainly request a urinalysis with micro and a urine culture to see if you actually have a urinary tract infection. You can also ask for imaging or an ultrasound that includes not only the kidneys and the ureters, but an ultrasound that also includes the bladder. And this can let your doctors know if even after you go and urinate and you try to empty your bladder, it'll let them know if you still have a backup of urine, if you have a post-void residual, or if you still have residual urine in your bladder even after you try to empty it. So that's one thing that can help. And if you find that you really are having nerve damage to the bladder, then ask your doctor to refer you to a urologist. This is a kidney and bladder and prostate surgeon. So when you go to the urologist, they won't necessarily grab you in there and put you on the operating table right away. No, they do assessments. They can do something called urodynamic studies, and it can really let them know exactly what's going on as far as any nerve damage in the bladder. As far as some smart food choices, if you have nerve damage to the bladder, a high fiber diet. Things like whole grains, lentils, vegetables. Here's how it relates. If you have a diet that's high in fiber, then you are less likely to be constipated. And if you are constipated, that can actually cause pressure to be put on the bladder, and that pressure can prevent you from properly emptying your bladder. So making sure you have a high fiber diet and that you prevent or avoid constipation is one way to keep you from retaining urine in your bladder. So now you see that your blood sugar is more than just a number. It's something that can seriously damage your kidneys by overworking them, scarring them, causing them to be leaky, damaging the blood vessels, and even the blood sugar can cause you to have a backup of urine in your bladder. Make sure that you follow up with your doctor regularly. Know what your blood sugar is. Know what your hemoglobin A1C. Make sure that you're screened for protein in the urine when appropriate. And very importantly, if you do develop kidney damage, be proactive and ask your doctor to refer you to a kidney doctor or to a nephrologist like me. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about.